Hi, Heather here, Pediatric SLP. What is your baby doing from 7 to 12 months? They turn and look in the direction of sound. They are starting to look when you point to something, right? They'll follow your gesture to the object. They turn when their name is called. They're starting to recognize their name. And they're starting to understand the names of common objects and people in their environment. They might be responding to certain words such as no, or come here, or do you want more? They'll show that they understand by responding appropriately. So if you say no, they might look a little alarmed, or if you say come here, they'll come to you. They're playing games with you more, like peekaboo and pat a cake, and they're also paying attention for short periods of time to songs and book reading. What is your 7 to 12-month-old doing expressively right now? They're babbling a lot more. They're putting consonant vowels together in long syllable strings like ba 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 ma 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 ma. They are using gestures and vocalizations to try to get and maintain your attention. So for instance, they might see something they want on a higher shelf and point to it and also say, eh, eh, eh. Or they might try to say the word and you may not understand it fully. They're pointing more to objects and showing you things in their environment, and they're using gestures more with meaning. So clapping, waving bye-bye, reaching their hands up to be picked up for up. And a common one right now is shaking their head, no. They're starting to say a few actual words that have meaning. And you might hear one or two or maybe more at this time. And this happens a little bit closer to the 12-month point. Some examples might be hi, or dog, or mama, dada. And if their speech is not clear right now, that's very normal. So don't worry about that. It'll get clearer within the next year. If your baby's not doing some of these things and you're feeling a little concerned, I have 4 things that you can try at home. Number 1, point to objects and name them during playtime. So you can do this while you're playing. You can do it during your daily routines. Maybe at breakfast time, you can just point to the apple and say, apple. You know, you're wanting to teach your baby that there is a word associated with the object. What you'll be doing is you'll be building their vocabulary really organically, very naturally throughout the day. You can do this with their toys, their food items. You can do this also during book reading. Number 2, expand on your baby's speech attempts. So this one is a really important one. If they have the word for dog or they're trying to say dog, you can say, yes, dog, big dog, big brown dog. So just expand and show them that there's more ways that you can say the same thing. It will introduce them to new vocabulary and also encourage them to try to talk more. Number 3, encourage gestures alongside speech. So showing your child that waving to represent hello is a meaningful way to communicate is very important, so they know that they have lots of ways to express themselves. Number 4, read to your child every day. I can't emphasize this one enough. This is a very important one, especially at the 7 to 12-month age when your child is absorbing so much. Even if your child isn't sitting for the entire book, that's okay. They can move around. They're still listening and absorbing the information, and they're seeing that you're reading a book, so you're setting a great example for them. If your baby's not doing some of these things and you're feeling concerned, I strongly urge you to reach out to a speech therapist. It gives you a good opportunity to ask questions and gain more insight into ways that a professional can help you and your family at home.